Hello and welcome to another edition of What's Your Why Wednesday. I'm Andrew Gofrak, our Chief Executive Officer, and I'm thrilled to be joined today by Dr. Louis Reier, our neurosurgeon. Dr. Reier, welcome.
Thank you for having me.
Absolutely. Dr. Reier, I'd love to maybe if you could tell us a little bit about your role here at ARMC and what you do, and then we'll get into the purpose and mission.
Yeah, so I'm a neurosurgery attending here at ARMC. I did my neurosurgery residency here previously. So, my role is anything on the spectrum of doing surgery to helping take care of patients in the ICU and taking ER consults involving anything pathology to the brain or the spine.
Awesome. Neurosurgery is such a fascinating specialty, and I can't thank you and the entire team enough for all the great work that you do in support of our patients. You have a fascinating story. I had the privilege of hearing that not too long ago. Would you mind kind of walking us through how you became a neurosurgeon and kind of the why? Because it's truly a fascinating story.
Absolutely. It is all about the why. So I'll make it long story short, but when I was 15 years old, I was in a snowboarding accident or snowboard crash, and I had launched off a cliff that was around 50 to 60 feet. It was late in the season, and what I couldn't see previously was there was a rocky crevasse. And so when I launched off the cliff, instead of landing on a nice steep slopes, I came straight down onto the crevasse, and instantly felt a shock or sensation shoot up my spine, and couldn't move anything. I was completely paralyzed from the neck down, and fortunately for me, after months of physical therapy, I made a near full recovery, but at the time it wasn't clear if that would be the case or not. So I became really interested and fascinated with the physiology of the brain and the spinal cord after that accident, and long story short, decided I wanted to dedicate my life to helping other people in similar situations to what I had experienced.
That's incredible, and if I recall correctly, after med school, you actually went into family medicine first for residency, always with that passion of getting into neurosurgery, and then
Yes.
partnered with our section chief for neurosurgery, Dr. Siddiqui, on really kind of changing that trajectory. Just maybe briefly explain kind of how you wouldn't give up in your pursuit and your fight to become a neurosurgeon.
Of course, so yeah, neurosurgery was what I wanted more than anything in medical school, but it's fairly competitive to get into. I did my fourth year of medical school. I spent time rotating at hospitals that had neurosurgery programs. One of those hospitals was Arrowhead Regional Medical Center, which was Dr. Siddiqui's program. Dr. Siddiqui was my program director, and I felt like I had a good rotation. I basically went in with the mindset I'm going to be the first one to show up, last one to leave every day, because it was something I wanted more than really anything else in life. But unfortunately, when the match came, which is when you find out what specialty you match into or get into, I didn't match into neurosurgery, didn't get in. So I took a position in family medicine, and a few months in, a spot had opened up, and Dr. Siddiqui called me and asked me if I still wanted the spot. I said absolutely, and after a few other little things happened, I got in and moved here, and the rest is history now.
7 years later, you graduate, yeah. and now you're continuing on in that fellowship and also an attending in neurosurgery. Your story is very personal, and it really connects to why you do what you do. How do you relate that to taking care of the patients that we have at ARMC? As you know, we serve the entire county of San Bernardino, and we see all different types of patients, all with critical needs, right? So how do you apply your own personal why in how you deliver care at the bedside or in the OR?
So yeah, that's a good question. To this day, I still remember that feeling of not being able to move and how terrifying that was, and all the things that came along with being in a hospital from that injury. And I really like to take a few moments and remind myself what that felt like, because a lot of these patients are experiencing the worst moments of their life. Mm-hmm. And it gives you the motivation to really want to go and do everything you possibly can for these patients, because you understand the suffering that they're going through. On a side note, Arrowhead is a unique hospital, and it's a county hospital and takes care of all types of patients, no matter what type of insurance you have. And doing my residency here and treating a lot of these patients was a very valuable experience. They're all very grateful for the care that they get and receive, and kind of motivates you to want to even do more for them because of the where they are at in socioeconomics and things like that.
I really appreciate that. It's clear, the passion that you bring to the bedside, will continue to save lives, will continue to impact lives. Doctors get into healthcare for all different reasons. We always hope that they get into it for the right reason. Clearly, in your case, there's that true passion as to we want to take care of our patients. And I really can't thank you enough for not only taking care of our patients here at ARMC, but also just for spending the time this morning with me and sharing your journey. It's quite an impactful story. So thank you.
It's my pleasure. Thank you for having me.
Absolutely. Well, this was another edition of What's Your Why Wednesday. Stay tuned for next month's edition. Thank you.